An historic day in England. Junior doctors are walking out for the first time since 1975.
It's incredibly historical, and I think it's incredibly sad that we've had to come to this point. None of us here today wanted this to happen. We were all very hopeful that the contract negotiations would be more successful, but we've not quite got there yet, and I'm very hopeful that we will get there, because all of us here today, and I'd like to believe that all of the public want to save the National Health Service, and we're all working towards making that happen.
The picket line here at Queen Alexandra Hospital in Portsmouth is one of many across England. The industrial action is all about a new contract. This is where the British Medical Association and the government are at loggerheads. Junior doctors say they have concerns about patient safety.
Really concerned. I mean, would you want a pilot flying your plane who's been awake for 50 hours? No, because you don't want him to crash the plane. Why would you want a doctor looking after your life and your family's lives who's also been awake for that kind of time period? You're just exhausted. When you're exhausted, unfortunately, people do make mistakes, and we just can't let that happen.
But the government says a new contract will make things safer for patients and fairer for staff. Health chiefs have offered an 11% basic pay rise for junior medics, but the number of unsociable hours would be slashed, decreasing overtime payments. The government has also suggested linking pay increases to training milestones rather than years of service. The government's aim? To improve its 7-day health service.
But we are determined to deal with this issue of having a genuine 7-day NHS. Everybody knows, doctors know it, patients know it, the management of the NHS knows it, the BMA knows it, that there is a problem with the NHS at the weekend, and one of the ways to correct that is making sure we have new contracts, including with junior doctors, to make sure not that they work longer hours. In fact, under our plans, many will work much less hours, not to reduce doctors' pay. No one who works legal hours will see a cut in their pay. Indeed, 75% of doctors will see a pay rise. So we think this is a good deal for a good advance in the NHS.
But junior doctors say the government just doesn't want to hire more or pay more. And it's a similar story in Southampton. Lizzie says restrictions on the number of hours doctors work aren't strong enough, and that would affect childcare.
Just for the fact that my little boy is going to be in nursery, my husband's also a doctor who's going to be working longer hours, and just for the fact that actually if safeguards are taken away with the new contract, and I'm potentially going to have to stay at work longer and there's no means of anybody having to sort of stop me being there, I'm going to be more tired, and actually, I've got less to give when I get home. So that's my sort of main concern, really.
Save our NHS! Save our NHS!
Student doctors are also supporting the strikes. They say the new contracts could encourage a brain drain of doctors in England.
Lots of us are already thinking about working abroad with applications to junior doctor positions. Lots of people have looked to work in Scotland and Wales, where the contracts might not be in place, where they wouldn't have considered that before. And some people, are reconsidering the profession entirely, which is, a real shame. I think people with the best intentions and the best reasons for going into medicine are starting to feel very disenchanted with the whole profession.
Junior doctors are providing only emergency care during this strike. Hospitals in the Solent area say they're keeping disruption to a minimum. A statement from Portsmouth Hospitals Trust says, "We would urge patients to choose well and to think twice before visiting our emergency department. We don't want to stop people who really need to use the emergency department from attending, but it is for emergencies such as breathing difficulties, loss of consciousness, severe chest pain, serious accidents and severe bleeding." 2 more 24-hour walkouts are planned for the end of January and start of February. The Health Secretary says the action is completely unnecessary. He's calling for more negotiations.
We've made a very fair offer to junior doctors based on independent advice. Unfortunately, we've now had this decision to strike, so we will do everything in our power now to make sure that the NHS remains safe even in the very busy winter period.
There are around 55,000 junior doctors in England. Talks have been ongoing for a couple of years. It now remains to be seen how quickly a deal can be struck. Dale McEwan, that's Solent.